Good morning and welcome to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. For the next hour, we're going to be giving you some great ideas on how you can look your best, especially if you've been not liking the way your eyes look. Good morning, Dr. Flaharty.
Good morning, Gina. How are you today?
Not liking. How did you like that? Dr. Flaharty is the medical director of the Azul Cosmetic Surgery and Medical Spas in Fort Myers, Naples, and Bonita Springs. And, you know, one of the first things we notice when we meet people are their eyes, and eyes are very telling for a lot of things. I mean, you really get a gauge on a person through them.
And it's interesting. There's been studies that track where you focus when you meet somebody, like where your eyes track on their face. And the majority of it is in the eyes and around the eyes, because that's where we, start to really see people, and you try to connect with people and maybe perhaps, trying to judge, understand the person. So
I think judgment is it's not fair, but it's accurate,
Yeah, it is. And I say that, it's funny. We have this no judging kind of rule at home. And it's funny because whenever anybody says something at the dinner table that might be a little bit judgmental, one of my daughters will say, "I didn't think we invited the judge to dinner tonight." And I was the one that introduced the concept to them. And now they throw it right back at me whenever
See what you do when you teach.
Yeah, right. Yeah.
The teacher becomes the student, or I think it's supposed to be reversed. The student becomes the teacher. However, in this case, the eyes, and when you think about it, women spend so much time. Sorry, guys, you don't do this as much, but making our eyes beautiful. Whether it's mascara and now the lash extensions, people are going crazy over all of that stuff to really make their eyes stand out.
That's a big mega trend is the lash extensions. And it's interesting with the lashes because we have Latisse and topicals that will make your lashes grow longer and thicker. It's really developed as a glaucoma medicine, and people noticed that people were putting these drops in, their lashes were getting longer.
Get
and
out,
thicker.
really?
Yeah, that's how it was discovered. Yeah. So then it was approved through the FDA to be used topically to grow the lashes, which is great. But in spite of that, there's a huge surge in these extensions now. And you have to go in about every 3 weeks to do those because your lashes grow. So they have to be redone. And they take, I just had a patient in this week and she had the longest lashes I've ever seen. They looked great. And we were talking about it. And I said, "How long does it take when you go in?" She said, 2 hours. So
Holy heck.
2 hours every 3 weeks. But, they look beautiful. And people are interested in it because it gives you very dramatic eyes, right? Yeah.
And that's just such a small part, of course, the makeup and the lashes, and but making our eyes look bigger or better goes a lot deeper than that's just on the surface. I mean, if we really want to improve the look of our eyes, then we come to you for things like Botox and fillers and all kinds of different treatments, including surgery, and we're going to talk about all of that today.
Yeah, for sure. And the eyes are, they are the focal point of the face, and so many things can happen that can change around them, even just like asymmetries of the brow or asymmetries of your eye or redundant skin or wrinkling or crow's feet, et cetera, it goes on and on. So there's a lot of things that can be done, some of, many of which are non-surgical, some of which are surgical. So we'll talk a little bit about sort of the common changes that we see and some of the treatment options we have for those. Yeah.
And one of the things that you've mentioned before on the show is that the eyes are one of the first things to age on the face, or they show it first for a lot of different reasons.
Right. So our eyelid skin is the thinnest skin on the face by far, and our eyelids are dynamic structures. We blink about 20 times a minute. We don't think about that. And then, of course, you rub your eyes in the morning to wake up, or if you have itchy eyes, allergies. Yeah. So they get a workout. So you have this thin skin that's highly mobile. It's not as affixed to the deeper structures. So that's why, you can see like people with allergies, or if somebody gets punched in the face around the eyes, they might have a lot of swelling of the eyes because that skin is very distensible, so it can swell very easily. So it's a very unique anatomy, and that's just the surface. It's very delicate at the deeper structures as well. But because of that thin, mobile skin, it does age a little bit quicker. It stretches. You get redundant skin in the upper eyelid where you start to see a little extra fold. You start to get the crow's feet at the corners from all the smiling. The creases start to become more fixed, and wrinkles and redundant skin in the lower lid as well.
Yeah.
Go ahead.
Well, I'm just going to say, and there's, no matter how much makeup and your lash extensions and your, the stuff, the contouring stuff, makeup you put on, you can't hide that.
Yeah, so makeup can't hide, extra skin on the upper eyelid. And one of the common problems with women is when that skin starts to hang down to the lash line, then you lose your lid plate. And that's that little area between the lashes and where the crease is. We call that the lid plate or the tarsal plate show. And that's an area where women put the makeup on, the mascara, to create, that color and add to that. And you can't really do it once the skin droops over, because then the skin will, mat it and it'll won't stay where you put it, right? So, and you don't really have a clean platform to put it on. And so that's something I hear a lot from patients as that skin gets more redundant in the upper eyelid.
Yeah.
And in the lower lids, what's called the orbital septum is a tissue plane that keeps the fat back. Our eye is cushioned by fat. That bony orbit where the eye resides is filled with fat. We have the globe and the muscles, as we know, the eye moves freely in that space, and that's because it's cushioned by all this fat that allows it to move in all these degrees of motion. But that fat doesn't stay where it's put. It tends to spread out with age, and the tissue plane to keep it behind the eye is called the orbital septum. That tends to get weaker with age, and we start to get the fat bulging into the lower lid. So the combination of gravity plus weakening of some of these tissue planes cause that fat to bulge forward into the lower eyelid, and you get, some bags protruding in the lower eyelid. And so that's something that you can see, kind of the bags under the eyes. And then beneath that, at that next level down, we lose fat from the face. So we're losing fat from the cheek area, and that creates those dark circles or hollows under the eye. So you get this, concave convex deformity, we call it, where the fat pockets are protruding, creating a bag, which is sort of convex, and then the cheek fat is descending and disappearing, creating a hollow under the eye, which is the dark circle or groove that a lot of people get under their eye.
So fat does a number on more than just our bellies. It's getting our eyes too.
It does, indeed. So there's, each year, obviously, we have more and more technology, more and more treatment options. So, for example, the dark circles under our eyes, that was something we didn't really have great non-surgical treatments for. We surgical treatments such as fat transfer or moving fat into that space to fill it in. Now we have fillers, which we can put in there, which is a really popular treatment. I do several of those every day in clinic, because pretty much everybody gets dark circles almost by the age of 30, and they tend to get worse. And some people, it's a little bit genetic, so some people worse than others. But filling in that is a very effective treatment for the dark circles under the eyes and some of those aging changes, contour changes in the lower lid into the mid-face.
So I guess you see a full range as far as ages when it comes in to take care of the eyes, because as you said, some people, it's just genetic, it's just the way they were made, and they're going to have some of these issues earlier in life.
Yeah, and the selfie generation is really interesting. I mean, this week I saw 2 women in their 20s who came in for dark circles under their eyes. That's not something that we saw a lot of 10 years ago, but I think now with all the selfies and people seeing themselves all the time, that's something that comes up more often now.
That's
people see even these subtle dark circles that are showing up in that, or, in the 20s.
Right.
So yeah, it starts at that age, and then obviously, by the 40s, you're often seeing some of that loose skin in the upper eyelid, and that's an age where a lot of people will come in to talk about blepharoplasty, which really is a technique where we just take out some of that loose skin of the upper eyelid to get rid of that extra folds and redundancy. And lower lids, may not need anything at that point. But, more times than not now in the lower lid, since we want to preserve fat and preserve volume, because we know we just get more hollow with age, and we don't want to accelerate the hollowness, we'll look at doing fillers for the lower lid or cheek to try to replenish that lost volume to create a more youthful fullness in the lower lid and cheek region. And if we can do that, that's the first step. sometimes when those fat pockets get too protruding, where they're just too bulgy, then you have to trim out some fat to really make the contour right. That's something we try to push off as long as we can.
Mm-hmm. So when we're talking about a lot of these things, the fillers, and we'll be getting into the surgery a little bit later, I know we're going to have to take a break here in a minute, but one of the things that we've always talked about before you do procedures is taking care of the canvas, which is our skin.
Right.
So we can do some things, and we can put some topicals on the skin around the eyes to help their appearance and the quality of the skin, can't we?
We can, and you've probably seen some ads on TV of some of these skin tightening topicals.
Oh yeah, I bought one.
Which are quite, did you?
I admit, I did it. I fell for it.
Well, those work temporarily.
Yes,
I mean, they can tighten up the skin, for a little while anyway. It's not a long time. We prefer a little bit more of a holistic approach in terms of, we have a couple of different topicals. One which is a very aggressive hydrating topical, which is nice hydration, will help to plump the skin and make it a little smoother. It's not a tightening like you see on some of those miracle creams. And then we have a peptide eye cream. So the Magic Eyes is the gel, and that is hydrates and is very nice. And then the peptide eye cream is a cream that helps to build collagen, so it's more of a gradual tightening and smoothing. And so people kind of select out for those depending if they prefer a gel to a cream. And those are more of a long-term treatment. They're not going to give you they do give you some nice improvement just with the immediate hydration, but it's going to improve the condition of the skin, which is really the goal, right?
Right, exactly. Yeah. All right, well, let's talk a little bit more about, I've got a few more questions about some of the topical products that we can use before we go into some more details. But we're going to take a quick break, and just want to throw out the website before I forget, azulbeauty.com.
Yes.
If you want to look that up while we're on a break, and you can kind of see some of the stuff we're talking about. It's a really great resource. Otherwise, we'll be back with more of Look and Feel Your Best in just a few minutes with Dr. Patrick Flaharty. I'm Gina Birch. Welcome back to more of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. This morning, our focus, pun intended, is on the eyes. So you were just talking about a couple of different creams that you have here at the Azul Cosmetic Surgery and Medical Spa. Are those some of the ones that your wife developed with Trilogy Labs?
Yes. Okay. Trilogy Labs makes both these products for us, and one's called Magic Eyes, which is aggressive hydrating cream for the lids, and that can really help smooth them out and tighten them by plumping them, adding hydration. And then a peptide eye cream, which we know the peptides will help build new collagen, which can improve, the texture of the skin, and that's sort of a gradual rejuvenation. So those are really good topicals for your lower eyelids. And sometimes just a very early changes. People start to see, my eyelids are looking a little bit crepey. That can do the trick, just getting you on a good hydrating cream. Okay. To help improve the texture.
So you can go to any of the offices and pick some of that up, and maybe make an appointment to see an anesthetician or something as well while you're there.
See one of the girls would be great. We also have a site where we sell the products directly, and that's called Azul Skin Health. Okay. So our regular website is azulbeauty.com, and that has everything about everything we do at Azul. But Azul Skin Health is a separate site that just has the products on it, and that has explanations about what each product is, how it works, and people can order right off that website as well. So the topicals are good, and that's always a good place to start. And we start to go beyond that. Okay, so the next level, when we're looking at the skin of the lower eyelid, which is, often one of the things that brings people in, wrinkling, the next level of treatment is what we call a medium depth chemical peel, usually a TCA peel. Now we do micro peels in the office with the estheticians, and that can be helpful too. But if we're doing something specifically to help tighten the skin of the lower eyelid as sort of a one-time treatment, a TCA peel is a nice peel. That's nice because I can do it right in the office. So it's called a medium depth chemical peel. We apply the chemical over the wrinkly, the lower eyelid skin, which is, you can see where the thin skin is because it's a little more wrinkly, and it turns the skin like a white frost. So it's a really cool treatment to do. You apply it. It stings a little bit. We don't have to use any injections to numb it all.
Okay.
there is a little bit of discomfort, but it's very temporary. So we apply the chemical, and what it does is coagulates the protein on the surface of the skin, so it turns those proteins white, and you can just see the result based on the color, which is kind of cool. That's the end point. So you apply it gradually with a Q-tip. There's some stinging of the lid. The lid turns white or pinkish white, and then we put a little 4x4 that's soaked in water and ice just on there to cool it, and that takes away the sting very quickly. And then we apply a little bit of ointment, and the patient has to put ointment on 2-3 times a day. They'll go home, their lids will be kind of pinkish red. Gradually they'll turn sort of a reddish brown over about 3 to 5 days, and then it'll actually peel, either flake off in tiny little flakes, or little sheets will come off. And when it peels, because it coagulates the protein on the surface of the skin, it's basically peeling the surface of the skin off. And when you peel the surface off, you're getting rid of a lot of the superficial wrinkles and most of those brown spots that are caused by the sun. And because the skin is so thin on the eyelid, this sort of delicate peel can make a significant difference in the tightening of the lower eyelid. And so you keep Vaseline on there for about a week. It's going to turn brownish, not look real pretty for the first 3 to 5 days, but once it peels, it looks beautiful. You have this nice, tight, new layer of skin there that's a little pink, and that pinkness can take anywhere from a couple weeks, even up to a month or two to fade, depending on how sensitive you are. But once the skin peels, you can, at that point, be in makeup and be back out and about. So it's a nice office-based treatment, doesn't entail any injections of light into the skin. And we do those eyelids and sometimes a full face just to help get rid of brown spots. Now in the laser era, we use a lot of lasers. But in the lower eyelid, TCA peel is a great in-office treatment.
That sounds like a good way to start off, if you're not really sure.
It's called a medium-depth peel. It's fairly mild. It does require the Vaseline, and you have to avoid sun. So there's but you can function fairly normally during that. And it gives you a nice result, having to do something surgical. Right?
Now, because you said this takes off some of the surface, all of the aging on the surface. Do you have anything that goes a little deeper that's still more on the non-invasive side? What kind of treatments you can use?
That's the most aggressive sort of non-surgical treatment, because you are actually peeling the skin, the surface layer of the skin. The next level, when we talk about lower eyelids, the skin of the lower eyelids specifically, there's sort of 4 treatments. We talked initially about just the topicals, the Magic Eyes or the peptide eye cream. That would be level 1. Level 2 would be a TCA peel. Level 3 would be a laser peel, and that I do in the operating room just because that's where I have my laser and we do laser resurfacing. The difference between laser peel, it's going to take off a portion of the skin and tighten the skin. The main difference of a laser peel versus the chemical peel is the laser generates heat. Heat shrinks collagen, and that tightens the skin. So you can tighten the skin up to 30% with the laser. And so that, you adjust the power settings to achieve the degree of tightening. So if somebody's got a little bit more wrinkling of the skin, then we'll use the laser, because that will give us a greater degree of shrinkage or tightening.
Okay.
So we have to make that determination based on, how much extra skin they have, how much wrinkles they have, that kind of thing. Similar healing time with the laser. We use a little patch over the skin for about 3 days. Then we do Vaseline. It usually heals in about a week, and it'll be pink. The pinkness lasts a little longer with the laser than the TCA peel. So it's a little bit more aggressive treatment. But once the skin is healed, you can put makeup on until that pinkness fades, and that usually is several weeks to sometimes several months for it to go away completely.
When you mention at the surgical center, the first thing I think of, this must involve some sedation, or no?
Well, yeah. I mean, if you were just doing a laser of the lower eyelid and nothing else, you really don't need the surgical center. You could numb the eyelid and do that in the office. It's just I happen to keep the laser in the operating room. Usually we're doing full face lasers, rather than just the eyelids. If the eyelids are wrinkled, and the rest of the skin probably is too. So, and we use the fractional CO2 now, which is a much nicer device in the sense of quicker healing. Fractional meaning we're not taking off the entire surface of the skin, just a fraction of it. It still gives you the tightening and wrinkle reduction. It still gets rid of most of the brown spots. Reduce the side effects of fully ablative laser resurfacing. Allows people to get very similar results with less downtime and less side effects.
It's really quite amazing. You know, we were talking about the website, azulbeauty.com, and I think you've got some before and after pictures on there.
Yeah.
And when I see those, I'm just always blown away at how that laser can really alter and make somebody look 10 years younger, and they haven't had any surgery.
You know, it just creates a whole new layer of skin. It's really remarkable. You're taking off the surface of the skin, and that's usually a sun-damaged skin that just has aged, and when you get rid of that dead surface layer, you're stimulating the deeper layers to heal. They'll go into full heal mode, aggressively healing it, and the new skin that heals is brand new, so it's new collagen, new elastin, a new layer of skin, the new surface, and it really is like erasing damaged skin and replacing it with brand new skin, and you can do that in a matter of 2 weeks. It's remarkable how much difference that can make.
That is crazy.
You know, when you think about the face and facial aging, that's one element of the face is the actual skin. So you have to look at that, and we can do anything from hydrofacials, micropeels, and topical products in the office, which are really nice treatments, very popular, no downtime, to prevent aging and for those early aging changes. But once somebody has more advanced ages from years of playing golf and tennis and gets the brown spots and the scaliness and the deep wrinkles, you can't fix that with just sort of topicals. You've got to go at it a little more aggressively, and that's where laser peels are fantastic, and they're remarkable. And we're doing a lot more of them now in recent years since the fractional lasers have come out, because it's less downtime and people are more open to that treatment, and it's still the best way to go for severe sun damage.
Right.
Yeah.
Well, it's nice to know that you can use that to kind of spot treat, for lack of a better word, and just take care of the eyes. But I'm thinking, if I'm going in there for that, I want the whole thing done.
Well, you hit on a point we talk often about here, which is making the most of that opportunity. If you're going to be in the operating room to do anything, whether it's a laser resurfacing or eyelids, then you want to make the most of that opportunity. And that's why my practice has evolved in the direction of doing more comprehensive rejuvenation of the face, where we'll often do brows, lids, face, neck, fat augmentation, laser, many of those elements or all of them at once. And it's now doable because of modern anesthesia and these modern techniques, which are quicker and safer. We can rejuvenate the entire face in a single session with 1 to 2 weeks of downtime, and then people are back to their normal activities with this totally rejuvenated face, which is great.
Right.
So the piecemeal approach, which was what we did for many years, just because that was sort of the state of the art, was limited. If you do a brow and lids, the upper face looks great, but the lower face not so good. Do a face and neck, but the skin is still sun damaged. You have to come back later to do a laser. Not ideal. Not doing fat augmentation. You can make the face look better with a laser, but you're still hollow. So when you start adding these elements together, you replace volume, lift and tighten to reshape the face, rejuvenate the skin, it's like wow results, and really has, just made quantum leaps forward in the level of improvement we can achieve with these treatments.
Yeah, I'm glad you mentioned that before we take a break here, because, we're focusing on the eyes today, and so many people come in and say, I want my eyes done, and I need my eyes done, and there's a whole different set. There are other reasons just besides vanity. I mean, sometimes it actually helps your vision. Right. But we'll talk about that a little too. But it's wow, my eyes look great, and now I've got the jowls, or I've got this, or I've got that, and it's like, gosh, man, I just want it all to match. And
yeah. So we try to talk about everything with, obviously there's a time and a place for just doing the lids if the lids are heavy, and that's a nice standalone procedure. But they do need to understand, if the brow is heavy, that could be contributing. If you don't lift the brow, you just do the lid, then you have to understand the limitation.
Right.
So it's an important thing to consider the related things with eyelids, which particularly brows, cheeks, and of course, as you mentioned, the rest of the face too.
Yes, because filling those cheeks can help get rid of some of those fine lines with the volumizing.
It can. And,
all right.
Yeah.
Well, let's talk about that. I'm starting to jump ahead into that, and we've got to take a quick break here. So we're going to talk more about eyes and some of the other treatments that Dr. Flaharty uses at the Azul Cosmetic Surgery and Medical Spas to make them look younger, fresher, brighter. We'll be right back with more of Look and Feel Your Best. Welcome back to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. This morning we're digging into the eyes and in ways that didn't sound good.
Digging into the eyes. What kind of person are you?
I don't know. There's sometimes I wish I could dig them out because there are things I wish I hadn't seen, but that's a fleeting moment.
That's
trust
for
me.
another day,
yeah,
right?
That is. That's a whole nother show. But when we're talking about the eyes, how to turn back the hands of time and make them look younger and brighter and get rid of the wrinkles and the bags and the dark circles. And I think we had been talking earlier just before we took the break about that and about some of the ways that we fill in and make everything look better. And sometimes putting fillers in the cheeks fills in some of the lines, fine lines around the eyes. But then there are other ways to get rid of those dark circles as well.
Yeah, I mean, dark circles under your eyes are, there's several causes for them, but the most common is just hollowness. We lose volume from the face with age, especially in the cheek area. We lose fat, and the bone starts to resorb too. So we get hollow under the eyes, which creates that classic dark circle under the eyes. And now we have ways to fill them non-surgically, just using fillers. And there's very specific fillers that work really well in that area. The key point there being that you don't want to have a lot of swelling. It's, as we talked about, it's a very delicate area. The skin is very thin. The skin is very distensible. So if you, and these hyaluronic acid fillers, their role is to attract and retain water. These are in our body naturally, in our skin and in our joints, and their primary role in our bodies is to plump tissue to attract and hold on to water, to plump our skin and lubricate the joints so that they move smoothly. And so this gel, which is made in a laboratory synthetically, there's no animal protein in it, very, very safe. It's identical to the same HAs that are in our body. Can be injected into this small little dark circle, or what we call tear trough deformity or hollowness under your eye. And we use a cannula technique, which is a new technique where it's a very blunt-tipped, very delicate instrument that allows us to layer the filler in very small amounts, which is the key, because you want to fill in the hollow, correct it, but not overcorrect it. You know that filler is going to attract some water and plump a little bit. And so it's a very delicate procedure, but it works extremely well and can last for many, many years. It's an area where fillers can even be permanent, because it's a low movement area. There's low metabolic activity in that region, and the filler just seems to last a long time. So it's a really nice treatment. We do this in the office virtually every day. The other nice thing about it, you can put numbing cream on the lower eyelid. It really numbs very effectively in about 20 minutes. Make one little puncture wound, and with this cannula, layer a little filler in and correct it. And it's really fun when we do this. I do one side, and then I show the patient in a mirror, and it's really fun to see. You erase the dark circle on one side.
It's immediate, the results.
It's immediate, yeah, you see it immediately. And then patients will use a little bit of ice afterward just to try to prevent any swelling. But with the cannula technique, because a cannula is different than a needle has a sharp tip, and as you put a needle into tissue, it's going to cut tissue. It's going to go straight through anything that's in front of it. If there's a vessel in front of it, it'll cut the vessel. That can create a bruise. Cannula is a blunt-tipped instrument, so when you put it into the tissue, it doesn't slide quite as smoothly because it doesn't cut tissue. It's going to work around the tissue. And so it becomes, you have to be facile with it, but it's a very delicate cannula, so it's pretty easy to pass through the tissue, but it's much less likely to cut a vessel. And so you have significantly less risk of bruising using the cannula.
That's good.
Which is great.
And so that fills in some of those dark hollows and the circles under there. When we were talking about lower lids, you said there was another issue with them as well, and that's having too much. So then we have the fat. Well, that gets into surgery. Should we wait on that?
Yeah, we can talk about that.
Okay, I just realized I jumped ahead.
That's okay. So yeah, I mean, one of the things often we'll do with lower lid fillers is also mid-face fillers. You often will come in because of dark circles under the eye. Look at the structure of the face. There's some flatness of the cheek as well. And so many times we'll add some volume in the deeper areas of the mid-face to lift the cheek, which takes away some of the flatness and gives people sort of a more youthful fuller, rounder cheek area. And you can do that in a very, very subtle way. We always laughed, anything that can be done can be overdone. And with fillers, we've seen these trends first with lips being overdone. And now I think, it's coming back to normal as people recognize more is not better all the time. Yeah. And same thing is happening in mid-face where people, a little bit is good, more is better. And at some point they're putting too much filler in the mid-face and the cheeks start to look really dramatically, enlarged. It does make your face, it helps tighten the skin and smooth it. So there's, some benefit to that, but you really want to look at the shape of the face and the aesthetics of your face and make sure it's in proportion to the rest of your face,
right.
And not create, over inflated cheeks, which, we've seen more frequently in recent years with the filler craze. But a little bit can work wonders to just make you look younger and healthier and almost at any age, which is really great because we all get hollow with age. It gets worse over time. And, patients sometimes in their 30s and 40s can look good with just a small amount of volume to lift the cheek. 50s, 60s, certainly, and patients 70s, 80s, and even 90s. I've had patients come in their 90s and have a big event and they want to look a little bit younger and healthier, and just putting a small volume in the cheek gives them a nice little lift and makes them look younger and healthier.
That's cool.
And it's fantastic.
Yeah, very good.
Yeah, it's cool.
So when we're talking about fillers mostly here for the lower lids, are there any type of injectables that we can also help the overall appearance or the upper lids, the crow's feet, besides fillers?
So the crow's feet would be Botox and Dysport, the forms of botulinum toxin. Those work extremely well, just small amounts. It's a very popular area, just tiny amounts, a few little injections at the outer corner of the eye. And numbing cream can numb that really nicely, so you hardly feel those at all. A couple little injections there will help weaken those muscles and reduce the crow's feet. It looks very natural. It's not going to make you look overly smooth or artificial. It just reduces the visibility of crow's feet that occur with smiling, and it just softens them, and it keeps those lines from getting deeper and worse. So that's a very popular treatment at the outer corner of the eye.
And you typically do that when you're doing the 11s or the forehead, or it just varies for patients?
The most common areas for Botox are between the eyebrows, the 11s, as you mentioned, the forehead, the horizontal lines, and the crow's feet. Okay. So those are very standard areas. And then we often will do a little bit in upper lip for vertical lip lines, or the corners of the mouth to lift, or the chin if the chin is marbled, or all these other little subtle areas like nasal lines, like the bunny lines. So there are a lot of other areas, but the most common are those three areas on the upper face between the brows, the forehead, and around the eyes. And that can really smooth out the upper face, make it look really good. Okay. And then for, lower lid, mid-face, and around the mouth, that tends to be more filler areas. Okay. Fill in the dark circles, lift the cheek, soften any of these lines or creases around the mouth, and add some volume to the lips if they've shrunk to help make them look more youthful. So, that's the liquid facelift, which is really a wonderful treatment that can be done, just in 20 minutes in the office and really make you look wonderful.
So we're putting on our topical creams on the day and night to make our skin look nice, and maybe we've done some of those chemical peels or the laser peel, and we've done the injectables, and we still are showing those signs of aging, and it's just not enough anymore. And that's when we move into the surgical realm.
Yeah. So the most common surgery of the eyes is upper eyelid surgery, and as you mentioned previously, sometimes that can be covered by insurance. It's the one area of facial surgery that sometimes is covered by insurance. When the upper eyelid skin gets so heavy that it's weighing down the lid margin, and a good test of that is if you close your eyes and relax your forehead so that the forehead muscles aren't lifting. Because when your eyelids start to get heavy, you start activating your forehead muscles to try to lift the brows so that you can lift the lid and get that skin out of the way to see better. It's subconscious. But if you relax the forehead, and that's how we test you when you come in, we help relax your forehead and look at where is the eyelid skin when you're your forehead is not active, and that kind of gives you the real true anatomic measure. And if the skin is touching the lashes or hiding the lashes, then often insurance will cover the cost of that, because it is affecting your peripheral vision.
Yes, and if you're out there driving on the road and you can't see the person next to you, it's a danger to all of us.
For sure. So peripheral vision can really affect driving, and often, one of the most common symptoms people have is tired eyes with reading in the evening. And, it's because what happens is if you're lifting your forehead all day long using those frontalis muscles, those big muscles that cause those horizontal lines in your forehead, they're strong and big muscles. They can lift the brow and lift the eyelids. But if you're doing that all day long, you get what we call eye fatigue and brow fatigue. Those muscles get tired, and that makes your eyes tired, and it's just hard to keep them open at night. So when you remove some of the extra skin of the upper eyelid, you're removing that extra skin that's hanging over, creating that heaviness or hooding, and then the forehead muscle can relax, and it greatly improves your tolerance for reading in the evening, because you're not working so hard all day to keep your eyes open. And these are things that happen subconsciously. People aren't even aware it's happening, but I've had so many patients, say, oh, gee, ever since my eyelid surgery, I have much better tolerance for reading in the evening.
Interesting.
Without even me asking, they're just volunteering that. So it can really improve your tolerance for reading, especially in the evening and afternoons.
How long is recovery from the eyelid surgery?
So in the upper eyelid, the most common thing we do is just trim out extra skin, because the skin stretches. That's what's hanging over the eye. You get just too much skin there. So we trim out the skin. We want to preserve the fat as much as possible, because we don't want to accelerate and make you look hollow. But sometimes a little bit of fat needs to be sculpted out if there's extra bags in the upper lid. And then we close with a very delicate stitch. That stitch typically comes out about 6 days later, and you have to be gentle with the eyelids for a couple weeks, no rubbing. We say no heavy exercise for a couple weeks, but you can function pretty normally after eyelid surgery. You're going to use ice that first day or two to try to keep the swelling to a minimum. Then you're going to have sunglasses on and be out running, fairly normal errands. But you will have some swelling. Eyelids swell easily, as we talked about, so there will be a little bit of puffiness that goes down into the lower lid and gradually fades over a week or two. So ice for a few days, sunglasses if you need it, just to hide that swelling until it goes down. And that'll usually be a little bit visible for a couple of weeks. But again, you can function pretty normally. You don't really have to be housebound or anything.
Yeah, it sounds like the recovery, that's fairly simple compared to
fairly simple. Yeah. With eyelids, the good news is there's very little discomfort, which everybody's happy to hear that. But there's always some visible signs. You always have some redness and swelling, and that's for a week or two, just depending on how you heal.
Okay. Let's take a quick break, and we'll come back and talk some more about eye surgery, eyelids, lower lids, and all of the great
let's talk about lower lids, which are a little bit more interesting.
All right. You're listening to Look and Feel Your Best with Dr. Patrick Flaharty, Medical Director of the Azul Cosmetic Surgery Medical Spas. I'm Gina Birch. We'll be right back. Welcome back to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. We're talking about eyelids, or eyes in general today, and the different surgeries and techniques and ways from very minimally invasive to full-on surgery to make those eyes look better. And now we're into the surgical realm. The eyelids, it seems like it's fairly straightforward. You just take out that extra skin and stitch it back up. And
it's delicate tissue, the eyelids, so it's really delicate surgery. I mean, I love it. It was the reason I went into ophthalmology and eye plastic surgery, because I just love the delicate anatomy around the eye, and working with that is really fun and gratifying surgically, because we can make so many positive changes. And we talked about the upper lids and how you get heaviness and hooding, and when the eyelids get heavy in the upper lids, not only can it affect your vision, but it just makes us look tired.
Yes,
that heavy upper eyelid makes us look less alert or tired,
and sad sometimes,
or sad and tired. Of the two things. And just upper lid blepharoplasty, where we're trimming out the extra skin of the upper eyelids, is a really safe, effective, and relatively painless procedure that can help make you look better. It just makes your eyes more bright-eyed and open, which is great. And sometimes insurance will cover it, but in all cases, it does make the eyelids look more vibrant and open.
That's just half of the eye, though.
Right, yeah. The lower lid is the other side. And lower lid is in some senses more interesting, because the anatomy is more interesting interesting, and the changes are perhaps a little bit more complex. We talked about hollowness and dark circles. That's a common early change in the lower lid, and we can fill that filler. And there are a lot more cases now that I'm doing in the lower lid non-surgically, just putting a little filler in to correct that dark circle, which can make the whole lower lid look better. So we talked about the fat pocket looking more bulgy as that starts to bulge into the eyelid, and then the hollowness beneath that, which is the dark circle. If you can fill in the dark circle to the point that it's even with the fat pocket, then you've improved the contour. So we have
like spackling on a wall.
Exactly. So you have the fat pocket of the lower lid, you have the hollow area beneath it, and then you have this mound, which is the mid face or cheek area. If you fill in the hollow between the two pockets, or the valley between the two hills, then you have just one smooth hill, which is the goal. That's a youthful contour from the lower lid cheek, and you can achieve that with fillers very often. And so there's a lot of patients who will start to see tired eyes and dark circles and some of these changes that we can fix just with a little bit of filler in the office, which is great.
And then even though you said, the eyes are one of the things that age the quickest because of all the movement, surprisingly, the fillers can last a really long time underneath the eyes.
Underneath the eyes they can, because that isn't really a high movement area. When you put it right over the bony rim of the orbit, it can just sort of sit there for a number of years. And we just know that from experience, having done this for the last 20 years or so, that some patients, you put them in the lower eyelids, and I have patients come back and go, well, I should have that done again. It's like, well, you don't need it done. They're still there.
Yeah, right.
They're thinking they need to have it redone because fillers aren't supposed to be permanent, but they can be permanent in certain areas, especially under the eyes. But fillers don't solve all problems, as we talked about with the skin and some of the other contours. So if the fat pockets of the lower lid get too prominent, where fillers alone aren't going to be enough, then trimming out fat of the lower lid can be done. And the best way to do that is called transconjunctival lower lid blepharoplasty. Yes, that's a mouthful. And that's where we actually make an incision inside your lower eyelid. It goes directly through the conjunctiva into the fat pocket area.
So we're going the interior.
Interior, yeah. No cutting of the skin, so it's invisible. We have delicate instruments just to help lift the eyelid so we can make that incision. And then, it's direct into the fat pockets. And then we can trim away some of that extra fat to flatten that area a little bit. Again, we don't want to make the patient hollow. We just don't want those fat pockets protruding, causing these bags that, again, make us look tired or heavy. And so trimming the bags from inside the lower lid is a great procedure. It's safe. It's painless. There's no stitches involved. The inside of the lower eyelid heals on its own.
Wow.
Just like if you cut your lip with, on the inside, you'll notice that'll heal by the next day. It's a mucous membrane. It heals very quickly. The inside of the eyelid will heal very quickly too, so we don't need stitches in that area. And you can nicely contour the lower lid. So removing fat from the lower eyelid, transconjunctival lower eyelid blepharoplasty, is a very popular procedure to eliminate the bags under our eyes, and we do that a lot because as we age, those fat pockets get bigger and bigger and bigger, and at some point, reducing will take away those big bags that make us look very tired.
Yes,
and
right.
it really, there's no way to hide that with makeup, and it just makes you look tired. And then we mentioned fillers for the hollowness. Fat augmentation is another thing we can do to fill in the hollowness under the eyes. Fat's nice because that's natural. It's your own fatty tissue, and it's permanent. It's a living tissue as opposed to filler, which is just a gel. And often if we do fat, we'll do it with a full face fat augmentation to replace volume elsewhere too. And then in the mid face too, that gets ages and becomes more shrunken, and so adding volume to the cheek will often be a part of that, whether that's with fat or fillers to help lift the cheek. And so we want that whole complex, the lower lid cheek area, to blend in as a nice single unit. If you look at a very youthful lower eyelid cheek, there's a very short eyelid, which means there's a small little horizontal crease, within 10 millimeters of the lash line, and then there's this nice soft mound of the cheek, and that's sort of the contour we want, like a short eyelid and this nice full mid-face. And as we age with volume loss, the eyelid gets longer and longer and hollow, the fat pockets start to bulge, and it goes from that youthful shape to, the fat pockets, hollow valley, and then the cheek. So we want to kind of smooth out those contours, and the fillers and fat help us do that, but sometimes we need surgery to trim out the extra fat so that we can improve that smooth contour.
Definitely. Got it. So then we've smoothed it out and the underneath looks good, but what if my problem now is I've just got laxity and I've just got saggy skin, and we plumped it up and we put fillers in, but there's nothing else I can do.
Right. So as with the upper eyelids, the skin is one issue, and then the deeper structures are a second. So the deeper structures are really dealing with the contour, trying to create a youthful contour. The skin is dealing with the excess skin, and that can happen in the lower lid as it does in the upper lid. And so the lower lid is more delicate because with gravity, there's greater risk in the lower lid. You can't, you don't want to overcorrect, take out too much skin, which could pull the lid away. You have to remember our eyelid is a very delicate functional structure. It needs to, when you blink, your upper eyelid comes down about 2/3 and the lower lid goes up about 1/3, and that covers your cornea and gives you this nice clear film so that you can see out of, it distributes the tears across the eye. And so it's a very delicate, important functional structure for vision. So in the lower lid, removing the extra skin can be done, but there's a very delicate technique called a pinch technique where we inject a very special type of local anesthetic underneath the skin. It separates the skin from the underlying muscle. We want to preserve the muscle because the muscle is what causes, helps the lid have tone and helps the lid blink. And so we can tighten the skin, but we don't want to over tighten the skin, and we don't want to remove the underlying muscle that's responsible for blinking and eyelid closure. And that's called a pinch technique. It's a really nice technique to help tighten up the extra skin. And then, as we mentioned, we can do TCA peels, which are to tighten up the fine lines and wrinkles, or laser peels to get a more aggressive tightening of the skin. And so there are these approaches to tightening the skin. And in the lower lid, we just want to be very cognizant and careful to make sure that the eyelid stays in a good position and has good functional movement. Right. As we mentioned, and I tell this to patients a lot, your lower eyelid needs to move. And if I make your skin super tight so that there's no wrinkles, then you have a tethered eyelid. It's not going to move. So you can't do that. You have to accept the fact there's got to be some redundancy of skin, because when you look up, the eyelid has to go up with the eye for it to function normally. And old style blepharoplasty is where people would make incisions under the lid and take out skin and muscle. Could make the lid look really tight and smooth, but that was a tethered eyelid that just didn't move normally. And when people were young, it might not have been a problem, but as they age, then they develop problems with tearing and dry eyes and irritation. And so you don't want to set somebody up for problems down the road. So with the lower eyelid, you have to just be very delicate when we're rejuvenating it. You can remove extra skin and tighten the skin and improve the quality of the skin, but it has to be done in a way that preserves normal function of the eyelid, and that's sort of a paramount concept.
And that's for the pinch. Now, you have a couple little stitches with the pinch technique?
Pinch technique, I use one little running stitch. It runs right under your lash line. There's a natural little groove there, so you typically don't see that at all, which is great. And, and sometimes, pinch is really a helpful technique to get rid of that redundant skin. But the other techniques as well with the peel and the laser peels can help to smooth out and improve the contour and quality of the skin in the lower eyelid.
Yeah, well, there's a lot of things we can do here. A lot of options, as you said, to really get those eyes to a more youthful appearance, and not all of them include surgery. Did you want to mention you touched briefly on the brow lift and how that? We don't have very much time. But
Right. Well, it's important, when we evaluate patients for upper eyelids, we always look at the eyebrow, because often, there is the brow will often have some heaviness and drooping as well. And sometimes it's mainly an issue, in which case doing the eyelids isn't going to be very effective. So you fall into sort of three categories. You either need just the lids and the brow can be left alone, or just the brow and you can leave the lid alone, or you need to do both. But we always sort of look at those and show those to the patient, because if somebody's got a very heavy brow and the lid is heavy as well, and you just take out skin of the eyelid will look more open, but your brow will actually be noticeably heavier because your forehead muscles relax, as we talked about. The brow will come down a little bit more. So your brow tends to descend 2 or 3 millimeters after eyelid surgery, and if it's already heavy to begin with, it'll be worse, and people don't tend to notice it because they think, oh, it's all just a heavy eyelid, but the underlying anatomy, tells us that the brow is heavy too. So those are conversations we have before surgery, which is really important because they need to understand that if you don't do a brow lift, you're going to have still some heaviness and hooding around the eyes, and that's okay as long, depending on the circumstances. So that gives them the option of saying, no, I'm not going to be happy with that, so we'll do a brow lift and the eyelid together. But making that choice up front is really important. You don't want them coming in after surgery saying, well, I'm really unhappy because these brows are heavy, and I didn't know that because you didn't explain it to them. Right. So we look at that. That's an important part of decision making in the upper eyelid area.
Come in for a consultation and find out what you need or could use, or all of there's so many different options. The Azul Cosmetic Surgery and Medical Spas are in Myers, Bonita Springs, and in Naples. You can jump online at azulbeauty.com and find those locations and get more information. Also, the phone number is 239-415-7576, 415-7576.
Sounds great, Gina.
We'll see you next week, Dr. Flaharty.
Next week, yes.
All right. For Dr. Patrick Flaharty, I'm Gina Birch. Have a great day, and thanks for listening to Look and Feel Your Best.